Hey everybody, Dr. Frost back again. You know, we're doing this series, Head to Toe Aches series, and today we're doing the hip. Well, the hip a lot of times looks like the back, and the back looks like the hip, and I'm going to give you a couple hints as to how to differentiate whether you have hip pain, back pain, or perhaps both. So, in that light, let's get started. When you have back pain, typically you'll do what we call the old man, old woman rise. And that means you get up from a seat or bed and you get up like an old man or an old woman. And then you put your hands on your hips and you stretch back. That almost always indicates that you probably have back pain. Hip pain, on the other hand, is a little different in that the person will say, I can't sleep on that side. The side that hurts, I can't sleep. I got to keep rolling off it. And the second thing, when you get up, you still have that stiffness, but the key here is you take those first 2 to 3 steps and they're painful. When that occurs, when I get that history in my office, I think of hip pain. So there you go. You've got something that looks like a little bit of back pain, a little bit of hip pain, hopefully not both. Now I'm going to give you a couple tricks to treat hip pain. You probably don't have a fancy therapy table at home, so you're going to probably use your bed. Try not to use the couch, please. And just do this. I'm going to give you 3 simple things to do. Lie flat on your back. Do you notice how, let's say my right hip is the one that hurts, my left knee is up. You simply drop the leg off the table, let it dangle. What is this doing? It's stretching, opening that hip joint a little bit, and relaxing some of those muscles while stretching others. So do that one first. Do it for about 3 to 5 seconds, see if it helps. If it hurts, probably an indicator that you got a more acute inflammatory problem and you want to stop. But if that's okay and it feels better, then go to the second one, both legs down. And I call these rocket ships because the rocket's going to take off, it's going to traverse the earth, and you're going to put your foot on the surface of the bed on the opposite side. You see how this internally rotates? The hip stretches all the butt muscles and the hip muscles and gives you some greater range of motion there. Now, the third one is what we call the hip flexor. That's the muscle that's involved with walking, climbing stairs, and you're simply going to do this, like you're marching. And you're just simply going to cock that hip back and forth, probably 3 times. And then the third or fourth time, grab that knee with both hands, hold it in a 3 count, and then relax. There you go. 3 easy ways to treat a hip and differentiate your hip pain from your back pain. Hope that helps. If it doesn't, we're in the office. Feel free to give us a call. Come and see us. Good to see you. Talk again soon. Bye-bye.